My name is Tim Duncan. I'm the Director of Human Resources at White Settlement ISD. And one of the questions that we get asked a lot is, what's going to happen if a student or a staff member tests positive for COVID? What's the plan and what are we going to do? Rest assured, we do have a plan. If a student or staff member is suspected of COVID, or if they test positive for COVID, then that student or staff member will need to stay home. They will be removed if they're at school when the symptoms start. And we will do everything we can to determine whether or not they actually have COVID or not. In the meantime, we're going to act as if the person is COVID positive. Once we know they're COVID positive, that also will trigger some events and some things that will happen. First thing is that classroom will be thoroughly cleaned by the custodial staff. We will start what we call contact tracing. We will work with the Tarrant County Health Department under the guidance of the CDC and TEA to determine who had close contact with the person who's COVID positive. Once the close contact is determined, then those people will be asked to quarantine as well for up to 14 days, depending on the individual situation. Is what determines close contact. Close contact is also referred to as exposure. Who was exposed or had close contact with somebody who tested positive for COVID-19. In order for somebody to have exposure or close contact with a positive case, they would have to have the person that was positive sneeze, cough, or spit directly in their face. That would create an exposure event. The other thing that would create an exposure event would be if a staff member or a student was 6 feet or more, then exposure is not considered very likely. The other thing we can take into consideration besides the 6 feet and the 15-minute duration time is where the COVID positive person and the staff member or student were one or both of them wearing masks. If both of them were masked, then exposure is going to be limited. Were they behind desk shields, which have been provided in all of our classrooms? Was the ventilation of the room good, and were they social distance as much as possible? The other thing we would look at on determining exposure or close contact would be frequency of hand washing. Are they using the hand sanitizers that are available in all classrooms on a frequent basis? If all of those conditions are met, the hand sanitizing, the mask wearing, the desk shields, and the social distancing whenever possible, and even when we aren't able to stay 6 feet away, is we're not doing it for long periods of time. If all of those conditions are being met, then we can say that exposure will be limited. Again, we will have to look at each case on an individual basis to determine who exactly was exposed. One of the questions was, so if a teacher or a student tests positive, then that whole group would have to go home. That's not necessarily the case. Again, we would look at the case-by-case exposure and determine in conjunction with the health department who had been exposed and decide who else needed to go home, if anybody. And then from there we would look and see what other steps need to be taken.